This is Dr. Saad in front of you, and today my topic is the malabsorption. So as its name indicates, mal means decreased or abnormal, means decreased or abnormal absorption of the nutrients such as the proteins, the carbohydrates, the fat soluble vitamins, the water soluble vitamins and minerals, water. So if they are not absorbed properly, so they will be appearing in the feces, and this is called as the malabsorption, means their decreased or their abnormal absorption of the nutrients is called as the malabsorption. Remember one thing, that this malabsorption mostly, in most of the cases, it presents with the, or most commonly it presents with the chronic diarrhea. Clear? It presents with the chronic diarrhea. Now, one hallmark of the malabsorption. What is the hallmark of malabsorption? So, hallmark of the malabsorption is steatorrhea. Steatorrhea. Steatorrhea, basically this steatorrhea is the increase in the quantity of fat in the feces, and your feces become bulky, yellowish, grayish colored stool is there. Clear? So this is your hallmark. The steatorrhea is the hallmark of the malabsorption. Now we are moving on towards the general symptoms, or you can say general features, clinical features. So what are the general features for this disease? First of all is the diarrhea. I already told you that diarrhea is the most common presentation for the malabsorption. So first will be diarrhea. Then obviously there will be weight loss. Then flatus. Then we have the, you can say, the passing of gas. This is called as the flatulence. Then we have the abdominal distension as well as abdominal pain also. Then we may have the anorexia. Then we have the borborygmi. What is borborygmi? Borborygmi is basically the noise in intestine due to gases. Noise or abnormal sound in the intestine due to the gases is called as the borborygmi. So you can also hear these sounds. Then we have the muscle wasting. These all are the features of malabsorption. So these were the general features of the malabsorption. Now moving on certain specific features, if you are talking about the specific features. So what can be those specific features? For suppose that we have the malabsorption of the minerals and vitamins. Clear? So their malabsorption of the vitamins and the minerals, they may lead to the anemia. How? For suppose that we have this mineral is the iron. If the iron, it is not absorbed and it is released from our body, so there will be iron deficiency, and you all know that due to the deficiency of the iron we have the anemia, and that anemia is called as the hypochromic microcytic anemia. Clear? So this is the due to deficiency of the mineral iron. Then we also have the deficiency of the vitamin, that is vitamin B12 or vitamin B9, that is called as the folic acid. These deficiency of these vitamins may result in the megaloblastic anemia. Clear? These deficiency of the vitamins, they result in the megaloblastic anemia. Clear? Then the deficiency of vitamins, they may also lead to the mucositis, means inflammation of the mucosa. Then specifically we may have the bleeding. This bleeding occur due to the deficiency or decreased vitamin K. Why? Because there are certain clotting factors that are dependent upon the vitamin K for their activation, and when vitamin K is deficient, so those clotting factors, they are not activated, and when they are not activated, they will not be clotting the blood, and when the blood is not clotted, so the bleeding tendency of the patient will be increased. So this is due to vitamin K deficiency. Then after bleeding we have the osteopenia and tetany. Osteopenia means your bones starts to dissolve and your bones become weak. Clear? So this osteopenia and tetany occur due to decreased calcium, decreased magnesium, and due to decreased vitamin D. Means vitamin D deficiency, calcium and magnesium deficiency results in the osteopenia, or you can say bone defects. Clear? Then we have the peripheral neuropathy. Peripheral neuropathy, it basically occurs due to vitamin A and vitamin B12 deficiency. Clear? So these are certain specific features of the malabsorption. Means if the vitamins, they are not absorbed, so anemia and mucositis can occur. Bleeding occur due to vitamin K deficiency. Osteopenia and tetany occur due to these deficiencies, calcium, magnesium and vitamin D. Peripheral neuropathy occur due to vitamin A and vitamin B12 deficiency. So these are certain specific features and these are the general features. Now after discussing these features, why the malabsorption occur? The question arises that why the malabsorption occur? What is the pathogenesis behind this malabsorption? So now we are going to study the pathogenesis of this malabsorption. Clear? Pathogenesis. Pathogenesis is that basically whenever there is abnormal absorption or when the absorption is decreased, it will be resulting in malabsorption. So basically normal absorption has 4 stages. Clear? Normal absorption has 4 stages. So any defect in those 4 stages may result in the malabsorption. So any defect in any of those 4 stages may result in the malabsorption. First of all, I am telling you the normal absorptive stages. What are those stages? First of all is your intraluminal digestion. This is the first stage. That intraluminal digestion occur where the carbohydrates, the proteins, they are broken down into the certain forms that can be easily absorbed. Clear? And this basically intraluminal digestion, in which the certain pancreatic enzymes, they are involved, and certain enzymes, they are involved in this intraluminal digestion. Then the second stage, that is the terminal digestion. In the terminal digestion, the carbohydrates, the peptides, they are converted by the disaccharides and the peptidases into the means on the brush border of the small intestine. Clear? In the terminal digestion, our carbohydrates and the peptides, they are converted into the or they are acted upon by the disaccharidases and the peptidases on the brush border of the small intestine. So this is the terminal digestion, second stage. Then we have the third stage. So after terminal digestion, we have the third stage. In this there will be transepithelial transport. Means after we have converted those substances, those large substances into the small one, now we have to transport them from the intestine, or you have to absorb them from the intestine. In this transepithelial transport, we have certain transporters that help in the transport. Clear? And then we have the lymphatic transport of absorbed lipids. Clear? Basically the lipids, they are absorbed by certain lymphatic channels, and those lymphatic channels, they are called as the lacteals, that are present in the villi of a small intestine. So this absorption of lipids we have also discussed previously, but just giving a brief review here, that the lacteals are the lymphatic channels, they are present in the villi of the small intestine, that helps in the transport of the lipids, absorbed lipids. So these are the 4 normal pathways or normal stages of the absorption, and defect in any one of these will be resulting in the malabsorption, and defect in them occur in many diseases, like in the intraluminal digestion. If the chronic pancreatitis occur, so there will be defect in this. Cystic fibrosis will be there. Inflammatory bowel disease affect this intraluminal digestion. Clear? If there is any means transporter defect, so transepithelial will be defective. If there is lymphatic transport of absorbed lipids, the Whipple disease occur and affect this one stages. Clear? So there are different diseases affecting the different stages of the absorption. Clear? So defect in these will be resulting in the malabsorption. Now we are moving on towards the diarrhea. I told you that malabsorption is most commonly presented by the diarrhea. So we will be discussing the diarrhea here. Okay, I am writing it here. Diarrhea. Now, first of all, we have to know that what is diarrhea. What is the definition of diarrhea? Diarrhea is basically increase in stool mass. Just concentrate on the definition first. Increase in stool mass, frequency, and fluidity. Clear? This is the correct definition of the diarrhea, that there will be increase in stool mass, frequency, and fluidity, and it must be greater than 200 gram per day. This 200 gram per day is the normally our body we excrete 150 to 200 grams per day feces. This is the normal quantity of the feces excreted per day by a normal human. Clear? In this means if the stool mass is increased. Now for suppose if you are excreting 3 times per day, feces you are excreting 3 times per day, but the mass is increased. For example, first you were 1, 2, 3 times per day, 50 grams, 50 grams and 50 grams. Clear? Now stool mass increase means that you are excreting same 3 times, but the mass of this is increased. For suppose you have 100 and 100 grams. So this become 300 grams per day that will be exceeding from this means normal range. So this is called as the increase in stool mass. Then we have frequency. Normally you excrete 3 times per day, but if the frequency is increased 4, 5, 6, 50, 50, 50. Now here you can see the stool mass is same, but the frequency is increased. So this will be 100, this 100 and this 100. So this become 300. Once again it exceeds the normal capacity. So in this way the frequency is increased. Then we have the fluidicity. Fluidicity means the volume is increased, means the water content in the volume that is increased, that will be resulting in the diarrhea. So this is the proper definition of diarrhea. There will be increased stool mass, increased frequency and the fluidicity above 200 gram per day. Sometimes this also happens that the patient come with the 14 liter per day loss of the fluid. So in those patients you have to transfuse the fluid immediately, because death can occur in this case in 14 liters per day. Clear? Then we are moving on towards certain types of the diarrhea. That what are the types of the diarrhea? Here we have the 4 types of the diarrhea. Number first is the secretory diarrhea. As its name indicates, secretory means that our body will be secreting certain substances, or you can say small intestine will be secreting certain substances, and that will be certain substances, you can say electrolytes, and that will be resulting in the overload of the fluid and will be resulting in diarrhea. That is called as a secretory diarrhea. This secretory diarrhea, it is not concerned with our food state, that if you are taking food so this diarrhea will occur. No. So that's why this diarrhea also persists in fasting. Means it is not concerned with the food. Either the food is present or not, this will occur. Secretory diarrhea will occur even in the fasting conditions. Then we have the second type of the diarrhea, that is you can say here in exudative diarrhea. So here exudative diarrhea is the diarrhea that is occurring due to the inflammatory condition. That if a microorganism have come that and your body means there is inflammation in your body or inflammation in the small intestine, so that inflammatory substance will be releasing the bloody or the purulent discharge will occur, and that is called as the exudative diarrhea. Clear? So this diarrhea is basically, this is also not concerned with your food in the fasting condition. Why? Because the inflammatory condition is continuously present there in your small intestine, and that is continuously irritating your mucosa, that will be resulting in the purulent and the bloody discharge, and that's why it is not concerned with the food condition. This also persists during fasting condition. Clear? So they both persist during the fasting condition. Then we have the third one, that is called as the osmotic diarrhea. Clear? Osmotic diarrhea occur for suppose when what happens when the solute comes in your small intestine. For suppose this is your small intestine. Clear? And here is your solute that is present. This solute, due to some reasons, this solute is not absorbed. Clear? When this solute is not absorbed, so this solute will also not allow the water to absorb. Water is not absorbed, and certain electrolytes, they are also not absorbed. Means these all substances, solute, water, electrolytes, they all are present in here in the intestine, and they will be excreted via the feces. Clear? So this is called as the osmotic diarrhea. Means water is not absorbed from here, that's why it is called as the osmotic diarrhea. Means certain osmotic solutes. Osmotic solutes are those solutes which attract the water. So if the solute is present here, the water will also be present in the lumen. It will not cross, it will not absorb. That's why the water, solutes, electrolytes, they all will be excreted in the feces, and that's why it is called as the osmotic diarrhea. Important thing here, that this diarrhea is decreased in fasting. Now what does this mean? For suppose solutes means that solute will present in your intestine when you will eat the food, because these solutes, where from they come from? Where these solutes come from? They come from the food. So if you will not eat the food, so these solutes will not present, and when these solutes will be not present, so the diarrhea will not occur, and water will be normally absorbed, everything will be normally absorbed, and these solutes, if they will not present, so the diarrhea will not occur. That's why there will be decrease of the diarrhea or relief of the diarrhea in the fasting condition. Then we have the fourth and the last one, that is the malabsorptive diarrhea. Malabsorptive diarrhea is a general term for the diarrhea in which there are certain any nutrients that are not absorbed. Clear? Normally the nutrients that are not absorbed will be resulting in the malabsorptive diarrhea, and those nutrients from where they come from? They come from the food. So obviously this one diarrhea will be also decreased in the fasting condition. So the first two, they persist during fasting. The second two, they are dependent upon the food. If the food is present, this diarrhea will occur. If the food is not present, it is in the fasting condition, this diarrhea will be absent or they will not persist. Clear? So this we have today, we have discussed about the malabsorption and the diarrhea. And one last thing here to be mentioned that I forgot to mention, that in the osmotic diarrhea, the diarrheal fluid, this is almost 50 milliosmol greater than the plasma concentration. Plasma fluid means 50 milliosmol more concentrated than the plasma fluid. Clear? This is a point noted here in the osmotic diarrhea. Clear? So today we have discussed the malabsorption and diarrhea. If you have any query, any confusion, you can ask in the comment section. Thank you so much. Allah Hafiz.